So first of all, this project is the result of a collaboration between three universities: the University of Alberta, University of Saint Boniface in Manitoba, and the University of Saskatchewan. It's our way to give voice to a neglected population, the Francophone living in language minority settings, such as the Canadian prairies. So let's start this talk with one question. Has the SARS-CoV-2, also known as COVID-19, pandemic affected the world? I think that everybody here agrees that the answer is yes. And several studies have clearly demonstrated that globally, the COVID-19 pandemic created an environment of uncertainty, stress, and even despair worldwide. And this specifically has posed new threats to families through social isolation, school child care closures, financial and employment insecurity, housing instability, and change in accessing social services. And this raised some concerns about inequities in health and well-being between majority and minority populations. And minority populations include language minority and immigrant populations across the world. And here in Canada, these concerns were of particular interest of official language minority communities, also known as OLMCs. And OLMCs include French speakers living outside of Quebec and English speakers living in Quebec. So what do we know about OLMCs and access to social services in Canada? It's well established that over the past 20 years, OLMCs face greater linguistic and cultural challenges in accessing social services such as health, family support in the official language of choice, French or English. And despite progress, several lines of evidence have clearly highlighted the inability to access social services in one's preferred language is a risk factor linked to a poor well-being. And this is linked to higher misdiagnosis rates and patient dissatisfaction. Interestingly, studies have also observed that during the pandemic, communities with a preferred language other than English had a higher incidence of COVID-19 infection and hospitalization due to COVID-19 in developed English-dominant countries. And Canada is a beautiful example of a developed English-dominant countries. Because we know that Canada is a multicultural country where both English and French are official languages, but English is predominant. However, we have 29% of Canadians who speak French, but the official language minority communities make up approximately 6% of the prairie population. And where do Francophones in the prairies live? While the province of Quebec exhibits a steady growth of Francophone population, most Francophones in the prairies live in Alberta, Saskatchewan, and Manitoba. And an increase of this population outside the French-speaking province of Quebec was observed. In Saskatchewan, we have 5% of the population who are French speakers, 6% in Alberta, and 28% in Manitoba. And let's see in details where we can find Francophone in these three provinces. Let me grab my laser point. Okay, so let's start with the province of Saskatchewan. In Saskatchewan, most Francophone live in Regina. So here in Regina, 27.7% of Regina populations. We have others in Saskatoon, so 21.9%, and Prince Albert, 24.3%. In Alberta, Francophone, the largest population of Francophone are mostly in Edmonton here and Calgary. But we also have other cities like, what's the name? Athabasca, Grand Prairie, Peace River, and so on, with 7 to 6% of Francophone population. In Manitoba, Francophone are really located in the south. The largest proportion is in Winnipeg. In Winnipeg, we have 58% of the Francophone population, and the Southeast represent 22.7%. So these are in details, briefly, the Francophones' location in the prairies. But who are these Francophones? Because we know that these Francophones, the population was increasing in the prairies, but what are their origins? Here on this map, we can see that in Saskatchewan and in Manitoba, most Francophone was born in the province. We have 53% in Saskatchewan and 72% in Manitoba. And the other proportion, 29%, was born elsewhere in Canada, and 18% was born outside Canada. Here in Manitoba, we have the proportion of Francophone who were born outside Canada or outside Manitoba are quite similar, 13% and 15%. And Alberta has something that is unique, because in Alberta, most Francophone were born outside Alberta. Only 25% of Francophone was born here in Alberta. We have 28% born outside Canada and 48% born elsewhere in Canada. And among most Francophone who were born outside Canada, Africa is the country of origin of most of them. This is what we got from Statistics Canada analysis. So we can really say that Francophone in the prairie, the Francophone population in the prairie is composed of a different and diverse minority populations, and mainly with immigrants. So, as I mentioned previously, impact of language barriers on accessibility, safety, and quality of healthcare services are well documented. Moreover, Canadians living in OLMCs, including Francophones living outside of Quebec, face similar language-related barriers to healthcare services to other language minorities. And finally, for populations whose preferred official language is French, limited access to health-related services in French was reported in the Canadian prairies. Therefore, we hypothesized that during the pandemic, issues of health inequities were exacerbated in Francophones' family living in the Canadian prairies. Consequently, we explored three different questions. And these are three key questions. The first one was, how has the COVID-19 pandemic affected Francophones' families in these linguistic minority settings? The second one, what are these population post-pandemic needs? And finally, which solutions were suggested by these unique population to address their needs? So we used an online survey written in French and composed of 22 questions covering socio-demographic information, impact of COVID-19 pandemic on families, post-pandemic needs and actions to better meet these needs. And from March to June last year, we recruited participants who identified themselves as Francophone. This was the first inclusion criteria. The second one, participants had to live in Canada prairies, so Alberta, Saskatchewan, or Manitoba for at least 2 years. So this means that participants had experienced the pandemic. And finally, participants have to be either parents, legal guardians, grandparents of children aged between 0 to 19 years old. So this figure shows the distribution of participants who were recruited across the 3 provinces. And here we can see that while most participants in Manitoba was located in the south of the province, and this is aligned with the location of Francophone in this province, a scattered distribution was observed for both Alberta and Saskatchewan. So this is really interesting for us to have an enrollment involving both rural and urban populations. We enrolled 610 participants, and among these, 319 was included for analysis. Of note, 152 was excluded because of several reasons. Some participants were excluded because they were not living either in Alberta, Saskatchewan, or Manitoba during the pandemic. Some were not either a parent or grandparent or legal guardian of children. Others did not answer to eligibility questions. And finally, some participants didn't provide the postal code. So we had 319 individuals for our analysis. Here are the social demographic characteristics of the 319 individuals. So first of all recruits referred themselves as Francophone. And participants were predominantly women. We have an average of 76% of participants who were women across the 3 provinces. The largest proportion of participants were young, so they were aged between 36 to 55 years old and well educated. We have 75% of participants who had either a post-secondary or graduate degrees. Canadian-born represented 55% of our cohort study, and we have 45. It's not 46 here. Sorry, it's 45% who were non-Canadian born. And since this project focuses on Francophone outside Canada, we asked some questions related to the support system in French. And contrary to Saskatchewan, to Saskatchewan and Alberta, the majority of respondents had a family or a system support in Manitoba. And this is definitely also aligned with the number of the Francophone system support in French, of course, in that province. Interestingly, even though all participants referred themselves as Francophone, we observed some differences among language difference. 32.3% were French dominant, 56.4% was English dominant, and finally we have 11.3%, 11.3%, sorry, were English dominant, sorry, and 56.4% they were balanced, English and French. And we need to keep in mind here that being balanced in French and English means that the individual can speak and understand and write both languages equivalently. Since the goal of our project focuses on families, Francophone families, so we assess number of children, age group of children, and their gender. And this is the information we had from our cohort study. We have 69% of our respondents who had children between 2 and 3 children, and the age of children varies between 2 to 19 years old. We didn't see a huge difference between the age group of children across the provinces. And both male and female were quite similar regarding the children gender. So this is our result regarding the impact on COVID-19 pandemic on Francophone families in the prairies. How much did the pandemic impact them? So here we have the negative impact, and here this is the positive impact. We asked both questions, and we can see here that 54% of negative impact, and these 54% include a lot, because we asked them how much did the pandemic impact them negatively. So the total of a lot and tremendous amount represent 54% of negative impact. But regarding the positive impact, only 21% of the population answered that COVID-19 pandemic affected them positively. So these two data, I think, were complementary. So we can say that the Francophone families in the prairies, because this is the result for the 3 provinces, have been really affected by the pandemic. Next, okay, so we have information regarding the impact. So we used a structural regression models to evaluate whether nativity status, official language fluency, and province influence well-being of Francophone during the pandemic. And regarding the nativity status, we compared Canadian-born versus non-Canadian-born. For language, we had the French dominant, English dominant, or balanced French and English. And for the province, we combined both Alberta and Saskatchewan and compared them to Manitoba. We had two reasons for doing that. Why Saskatchewan and Alberta? Because these two provinces, seems to have a lower number of support service in French. And moreover, in Saskatchewan, we had a small sample size. So we combined these data from these two provinces and we compare them to Manitoba. And this is what we did. So we used this model to see whether we have any influence coming from these three variables on negative impact and positive impact. This means that influence of well-being. And the well-being was defined by perceived overall negative and positive impacts. We explored also whether these effects, so the effects is the negative impact and the positive impact, were mediated by social service-related problems. And social service-related problems includes what? Finding information about services in French and assessing them. And in our studies, we used 4 different indicators of problems finding information in French about social services and 4 specific indicators of problems assessing social services in French. And this is our data. Our analysis uncovered 4 main themes that lead to more negative impacts of the pandemic. The first one is the following. Oops, it's working. We observed that French dominant individuals were more likely than English dominant individuals and balanced bilingual to have experienced a less positive impact of the pandemic overall. The second theme is related to the nativity status. We have demonstrated that non-Canadian born individuals had a greater and harder time finding information in French about social services. And interestingly, non-Canadian born than Canadian born participants were French dominant. The third theme is associated to the language again, and here we have identified that French dominant individuals were more likely than English dominant individuals and balanced bilingual to have a harder time finding information in French about social services information and access. And finally, participants reported having a harder time finding information in French about social services and assessing them in Alberta or Saskatchewan than Manitoba. So here is a brief summary of the first part of our study. Our study have shown that most Francophone families in the prairies have experienced a negative impact of the COVID-19 pandemic. Moreover, being non-Canadian born increased the likelihood of being more fluent in French than English and facing greater information problems. Being more fluent in French than English increased the risk of facing greater information and access problem. And finally, we concluded that living in Alberta or Saskatchewan increased the risk of facing greater information and access problems. So this was what we got regarding the impact. And as I have previously mentioned, we also evaluate the post-pandemic needs among the Francophone families. 13 post-pandemic needs were indicated by the study population, from access to recreational, athletic, and artistic activities for children and youth. And among all these 13 needs, access to healthcare professionals in French, access to mental health services in French for children and youth, quality education services in French, and feeling the belonging of a Francophone community were the 4 main common needs that were shared between the 3 provinces. And we studied the risk factors associated to these 4 main needs in the 2 groups of population, Alberta and Saskatchewan, compared to Manitoba. And regarding these shared needs, we observed that not born in Canada, so immigrants, was significantly associated, so being an immigrant was significantly associated to the need of feeling part of the Francophone community. This was in Alberta and Saskatchewan. And in Manitoba, however, any significant association wasn't identified for the shared needs. Interestingly, besides the 4 main shared needs, in Alberta and Saskatchewan, we identified that social activities in French for family, it was a specific need for these 2 provinces. And importantly, since the goal of our project was related to well-being, we observed that having a family support or support service was associated to this specific need indicated by Francophone population in Alberta and Saskatchewan. In Manitoba, curiously, for family, be able to work in French was a specific need for this province. And curiously, French balanced English and French. So being balanced in English and French was associated to be able to work in French. And here, what this means in our analysis, this means that being English dominant was associated with a higher need to work in French compared to those who were balanced French and English. This was really unexpected data, but this is what we got from the risk factors analysis. So a quick summary regarding the Francophone post-pandemic needs. We identified in our studies that 4 common post-pandemic needs were for Francophone families across the Canadian prairies to feel part of a Francophone community, to assess healthcare professionals in French, to assess quality education services in French, to assess mental health services for children and youth in French. These are the 4 common post-pandemic needs. For families in Alberta and Saskatchewan, having a family support or a system support in the province were associated with a higher need for social activities in French. And finally, for families in Manitoba, being English dominant was associated with a higher need to work in French compared to those who were balanced French and English. Now, the last part of my presentation today and the last part of the last aim of our project is related to solutions that were proposed by the study population to address their health and well-being needs. And for today's presentation, I have selected only solutions focuses on health and well-being because this presentation is about health. And here you have this graph showing 3 main proposed solutions by the Francophone families across the 3 provinces. And we identified that provide more resources for seniors and caregivers, to strengthen the healthcare system and provide resources in French to support the development of children and youth as the top 3 of solutions suggested by the 2 groups of Francophone family. And they have really highlighted in terms of development, they wanted some resources in French to support the development of children and youth, but mainly related to depression, children and youth with disability, abuse, all these different kinds of things. So, and we also studied the factors that were associated to health and well-being solution in Alberta and Saskatchewan and in Manitoba. So this table shows this information for Alberta and Saskatchewan. And here, this is what we had. So as expected, French dominant language level and support system were both associated to the strengthening of the healthcare system in Alberta and Saskatchewan. And these includes offering more appointments, expertise, so health expertise in French, and more French speaking professional. Similarly, in Manitoba, here we have both French dominant language level, but also balanced English-French level who were associated to the same solution. So based on this data, it seems like Francophone families living in the Canadian prairies are really highlighting the need to strengthen the healthcare system by offering several things in French. So in conclusion, this is my take-home messages for you. A significant proportion of Francophone families in the prairies were negatively affected by the COVID-19 pandemic. Moreover, immigrants and those who speak more limited English were more susceptible to issues in well-being. Despite progress, having health and mental health services, quality education, and community belonging in French were key post-pandemic needs in Francophone families in the Canadian prairies. And finally, offering health and social related services in French to this unique population, including senior, youth, and children, and resources to caregivers as major actions to support Francophone families in OLMCs, such as Canadian prairies. Our study has some limitations. The first one is the lack of sufficient power to compare all the 3 provinces individually, because we combined both Alberta and Saskatchewan, because of the sample size in Saskatchewan. So this was one limitation of the study. The second one is our study wasn't designed for structural regression modeling. So as a result, some categorical variables had to be combined for analysis, which limited our conclusion that are related to this model. Third one, we didn't hear male voice. Male voice was really missing in our study because most of our respondents were women. We had 76% of our participants who were women, okay. And finally, it's related to the language. We chose to use the difference score between fluency in French and English to emphasize a common effect expected in the French-speaking communities of interest. However, in using this difference, we have no way to assess the impact of a person's fluency in each official language. So I would like to acknowledge our wonderful team in University of Saskatchewan, Dr. Adelaide. She is the nominated PI for the project. Elise Prou-Cullen, she is a PhD candidate working on the project. At University of Alberta, we have Dr. Danielle de Moissac. She is the PI for the province of Manitoba. Melanie Chaput, she is a 4th-year undergraduate student. Here at University of Alberta, my friend and colleague, Dr. Kristen Marshak, she is a co-applicant on this project. So her lab did all the regressions, structural regressions, and risk factor study. Marianne Turgeon, who is a master's student working on the project, and Kathleen Kew, she is a 3rd-year undergraduate student, and she started working on this project since the beginning. So I'm really, really pleased to work with her. Acknowledgement also to our knowledge users. So in Saskatchewan, we have Réseau Santé en Français. Here at University in Alberta, Réseau Santé Alberta, and Santé en Français in Manitoba. And a big acknowledgement to all these Francophone families who were recruited, in the prairies. And thank you also to the project was funded by CIHR. Thanks. And merci beaucoup.